So let's take a look at an unusual case where we have a very large interdigital nerve. We can see there's inflammation surrounding this region, as seen here in the intermetatarsal bursa. When we look at its relationship to the plantar plate, we can see that there is an associated plantar plate tear at the lateral aspect of the third. Also note that there are erosions and bone marrow edema not only at M3 but also M5, M1. In a case like this, we would suggest that there's underlying rheumatoid arthritis. Getting back to this lesion, as has been described, this pericapsular fibrosis accompanies most cases of plantar plate tears. And in fact, it's a very important early sign to pick up, again, because these pericapsular pseudoneuromas can identify a plate tear at an earlier sign in the disease than was previously thought. So in the past, if we were to think that this enlargement of the interdigital nerve was a neuroma and we treated the neuroma, we would miss the fact that there is a large tear of the fibular side of this plantar plate. And you can see on the sagittal images just how thinned out and torn this plate is and the stress-related edema that's occurring in the metatarsal head. Also notice the exaggerated joint effusion and the cartilage loss in this location. So pseudoneuromas and neuromas do have a crossover, especially when they're this large. This one causing certainly a degree of pain and mass effect, exacerbating the erosion and altered biomechanics. I'm certain that the patient probably experiences a click. Now let's take a look at this fourth interspace where we can see this enlargement of the interdigital nerve here, and we can see the two limbs. And again, there is some kind of inflammatory change or this intermediate T1 and T2 signal lying closer to the fifth MTP joint, which also has a very large tear of its plantar plate itself. We can't even identify a normal U-shaped structure to even say where that plate is. And when we look at the sagittal images, you can appreciate the high-grade tear that's occurring on the fibular side of this articulation. So again, pseudoneuromas versus neuromas, the important distinction is twofold. Eccentric pericapsular fibrosis, now recognized as an important and useful correlate. It can be more readily apparent than a small defect in the plantar plate itself, so we're going to pay close attention to any pericapsular capsulitis or synovitis so that we can avoid misdiagnosing those as neuromas. Thank you.